All right. Good evening, everyone. Now we have eight student, not eight, seven student joining. Five, one, two, three. Who is not here yet? Rafiki, message kawan-kawan suruh join. All right. Maybe we'll start our last class now. In today's class, we are not going to go for a new topic. We will focus on how to prep for your final exam. And you can hear me, right? Thumbs up if you can hear me. Yep. All right, Nada. Thank you, everyone. So our goal today is not telling you what topic that will come out in the exam, but to help you understand how to think when to answer an open book question. So I hope that this can be useful for others open book exam. Dr. Imran class, Dr. Anida, Dr. Nas, and also Dr. Azza. Okay, and hopefully after this session or after this class you will have a much clearer idea of what to prepare, what to bring to the exam hall, what the examiner are actually looking for. And first of all, remember this is an open book exam. So many students, when they hear the word open book, they will think that that's okay, you can just bring any notes during exam, you can bring the thickest book in the exam. All right, so unfortunately it doesn't work that way. If you spend like for example one question, you spend 10 minutes looking for one piece of information, okay, and then you already lost like few minutes there, and then you will waste your time. So the purpose of an open book exam is not to test your memory. Instead, this open book exam, we design it to assess whether you can apply, you can link all the information that you have on your table, in your lecture notes, or what you have learned throughout the semester. And I want to see that the examiner usually want to see how you can analyze the patient, how can you understand the biomechanics, and how you can choose appropriate for my class, appropriate orthosis, in order to justify your decision and explain your reasoning clearly lah. So if you will notice that the question, me, Dr. Imran, and Dr. Azhar, our question will not be direct. It will link you with the problem that the patient have, the design of the prosthetic or orthotic, and they want you to give a critical thinking, have a critical thinking, and to answer that question. Okay, that means no, sorry. Usually, for one case, for example, one clinical scenario, usually I will see that most of you will have different answer. But don't worry, in clinical scenario, usually that there's no one perfect answer. So in clinical practice, the two clinicians, they may recommend different things, may recommend different orthosis, but both can be correct as long as you can justify why you prescribe this, why you prescribe that. All right, and maybe you need to compare between the orthosis. Like for example, in the question give you orthosis A and orthosis B, which one should you prescribe to the patient, and justify your answer. So as long as you can justify your decision, or using biomechanics, using anatomy, using like muscle problem, patient needs, where it's appropriate, and the evidence from the literature, so it should be okay. So today, rather than memorizing all the facts, I want you to start thinking like a prosthetist, like an orthotist, whether whenever you read the question, don't immediately think what is the answer. Instead, ask yourself, what is the problem first? We start with the problem. What is the problem the patient is facing? And then what information do you already know? Like for example, this patient have difficulty in climbing stair and then has pain here and there. So you need to know, get all this information first, and then what is examiner is expecting from you, expecting for you to demonstrate. All right. So throughout today's session, we will go through the overall exam structure, discuss what each question is assessing, identify the common mistake the student usually make, and most importantly, talk about how you can score higher, how can you get a good mark by improving the way you answer, the way you present your justification. All right. So So before we jump into the topic, I'd like to share what we are going to achieve in today's session. By the end of this class, I hope that all of you will have a much clearer understanding of how the final exam is structured. Okay, you can see, you can read the COPO, the course outcome in the course information, the borang tiga, and I hope that okay, you know how to answer, you know how to not to give uh, a direct and wrong answer. And then usually sometimes students they lose mark because not that they don't know the content. You know the content, you know the impairment, you know what orthosis to prescribe, but because they don't understand what is the question is actually asking. So today we'll go through the exam from the examiner perspective, and we'll also discuss what each question is really assessing. Every question has specific course outcome, and the learning objective behind it. Once you understand that, it will become much more easier for you to decide what information you need to put in your exam answer sheet. All right. So another important goal is to help you develop the strategy for answering higher order questions. So not all question like direct, and most of the question in the exam are not simple recall question. They require you to analyze a patient, apply biomechanic, justify your decision, compare different options, and sometimes even design an experiment. Okay, design an experiment. This is one of the important things in the final exam. So we'll talk about how to approach this type of question step by step. And finally, since this is an open book exam, I'll also give you some tips on preparing your notes. It's not about bringing as many notes as possible. It's about bringing the right notes and organizing them well so that you can easily find information quickly during the exam. All right. So, so that we know how we are going to cover today's topic, we'll look at how overall structure of the final exam. All right. Your final exam four structured question, or actually three structured question. All right, and together they will contribute 40% of your final course grade. Okay, three question, like maybe question one will have 10, 10, and then 20. All right, and then although there are only three questions, don't underestimate them because each question will be broken down into sub questions. So question one will have one A, one B, one C. And then the first thing I want everyone to remember is that every question is compulsory. So you need to manage your time wisely. Don't spend like too much time trying to perfect one answer for question one, and then you don't have time to finish the remaining question. So the exam duration is 2 hours, which is actually sufficient. If you are well prepared, make sure you know the time for the exam. You get your timetable or not yet for exam? Belum check kan?
Got got ready.
Okay, bila exam kita?
Um,
Tak apa, nanti check, nanti tulis dalam okay, you can share with the classmate in the group. Alright. Okay, the exam is 2 hours, so you have time actually. My advice is to spend few minutes. Okay, first when you get the question, spend few minutes to read through all the question first. Understand what each question is asking you before you start writing. And another important point is that for open book exam means that you can refer to your printed note lah, textbook, the orthotic notes. But remember, your notes are only there to support your thinking. They are not meant to replace your understanding. If you are constantly flipping hundred of pages looking for information, you will quickly run out of time. All right. I would like to highlight. I like you to highlight the key message on the right side of the slide. Okay. This is not memorization exam. I'm not interested in seeing whether you can copy from the textbook, from our orthotic notes. Okay. Don't no need to see AFO is da. No need. All right. Instead, I want you to see whether you can apply your knowledge to solve clinical problem. And throughout the paper, you will be expected to analyze patient condition, explain biomechanics like I mentioned just now, recommend appropriate orthotic intervention, and most importantly, justify your decision. Okay, remember in orthotic there is rarely one correct solution. So Amrin can have solution A, but she justify the the answer, and then Nada can have the other answer. So whenever you answer a question, think like you are discussing in a real patient in the clinic. So ask yourself first, what is the patient problem? What is their functional goal? Which orthosis best address those problems, and how can you justify your decision using anatomy, using biomechanics, using evidence, like for example journal. If you can check answer those questions clearly, you already on the right track lah. Okay, now let's talk about something that I think many students misunderstand, the term open book exam. So when students hear open book exam, open book, the first reaction is usually that's okay, I can just look up everything during the exam. But in reality, this is probably the worst strategy. So you have 2 hours, like I mentioned just now. If you spend 5-10 minutes sharing searching through your notes, every time you get stuck you will quickly run out of time. So here the purpose is not to test how well you can search information, it's how you can link all the information. All right, another thing you need to remember is that you need clinical reasoning. For example, if I ask you to design an orthosis, I'm not looking for a textbook definition like I mentioned just now. All right, so don't prepare to print every lecture slide. Instead, prepare a smart organized note so that they can help you to think and support your answer rather than becoming something that you need to read from beginning to end during exam, right? So what to bring during the exam? My first advice is don't bring everything. Some students print hundreds of pages, research paper, textbook. During exam, you don't have time, and they spend time searching that more than writing. That's not what we want. Okay, you will use this because in the next year 4, you also have a lot of exam. All right. My first advice, don't bring everything. Instead, bring an organized note. Think of them like a quick reference guide rather than something you will read from the start. You know, you know what to expect in your exam. You will have problem, you need a solution, biomechanics, muscle. And for this course, I would recommend you bringing your lecture notes because they contain the core concept like that we have discussed. And throughout the semester, you should also prepare comparison table. For example, compare different type of AFO in Seoul. For example, compare different or different orthotic material, for example. And these are much faster to refer than reading through a paragraph or notes. And also some question they may involve gate analysis or biomechanics. It is also useful for you to bring some diagram, like for example the gate cycle, lower limb anatomy, pressure system, orthotic component, as well as labeled diagram of the disease of the pathology. So for question 2, I already give you the tips for question 2. For one of the question, you it will involve an evidence based practice. I will jump on this topic later. You may also want to bring few important journal article. Okay, I will share some journal with you where you need to bring all of this, but make sure you highlight all the important information from that journal. You don't need 20 papers, just 2 or 3 key reference that you will understand well. And finally, don't forget professional one guess who is this?
Doctor,
Yep.
Cat is trying to join the meeting.
Dah.
Okay.
Okay. For question, and finally, don't forget professional reference. If you have a copy of uh, prosthetic orthotic code of conduct, but in this exam, you don't have question related to ethics. Don't worry. So in the future, if the exam you have ethics element in your subject, please bring orthotics code of conduct document or ISPO guideline or the other professional standard and bring them along. Yeah. So this may be helpful when you're discussing some problem related to ethical and professional issue. And one more tip: use colored tab easily. It's easy for you later in the exam hall because you will be nervous, and then maybe you can have like some sticky note or dividers to organize your notes. So during exam, you shouldn't be flipping through the pages, page after page, trying to find information. And ideally, you should know exactly where is everything is. And remember, the quality of your notes is much more important than the quantity. All right. Um. Now let's start with the one of the this is, I don't say that foot drop will come in your exam. Yeah. So this is like the just the example. Okay, maybe food drop will come, maybe it will not come. All right. I do want to explain what the question is trying to assess. So the question is mainly testing your understanding of anatomy, first anatomy, the physiology, the biomechanics, and more importantly, whether you can integrate all these all this concept together. So when you see one patient or in the exam paper, they will prescribe the condition of the patient with a particular condition. Do not jump straight on recommending what orthosis that you can prescribe. So that is one of the most common mistake the student make. Before thinking about the orthosis, you need to understand what the problem actually is. You need to ask yourself a few questions, like for example, what muscle are affected? Are they weak? Are they tight? Are they paralyzed? Okay, and then maybe which muscle are no longer functioning normally. And second, how does this muscle weakness affect the joint? Just now is muscle, right? And then how that this muscle affect the other thing, affect the joint. Does it reduce the stability of the patient? Does it cause abnormal movement to the patient? Does it change the alignment of the leg? And then third, how does this affect the patient gait? Just now the joint. Now, if joint is affected, maybe it will affect the gait of the patient, right? So what abnormal gait pattern would you expect to see during which phase of the gait cycle? Does this problem become more obvious? Like for example, flat feet, when they do during sun phase, okay, the foot will spread. And once you understood the pathology and the biomechanics, only then you should think about what to prescribe, what orthosis you can prescribe to the patient. And orthosis is not prescribed because of the diagnosis alone, it is prescribed because of the functional problem experienced by the patient. So instead of thinking, so this patient A has muscular dystrophy, therefore I prescribe this orthosis. I want you to think this patient has the biomechanical deficit, therefore this orthosis A is most appropriate solution. And that's completely different way of thinking, and is exactly what distinguishes an average answer from an excellent one. So for any question that is related to this type of that need this type of information, please do not memorize the disease. All right, understand the disease, focus on understanding it, the relationship between the muscle function. I will share with you example later, the joint mechanics, the gait, the orthotic intervention. All right. Okay, let us let use this type of uh patient, okay, to understand how muscle weakness can affect the whole body. So one important thing to remember is that muscle, they do not only produce movement, they also help to stabilize and maintain the posture. So when muscle become weak, the body will try to compensate, okay, using other muscle by changing the walking pattern. That's why children with this disease relate is the standard picture of the Duchenne muscular dystrophy, DMD. All right, you can see from your orthotic notes. So this figure also very important for your final exam. Okay, so this DMD, they don't have only weak muscle, they also develop abnormal posture. If you can see from the picture, they they have abnormal posture, abnormal gait, they have contracture, they have balance problem. We will go one by one. Okay, like for example, if you see here, Okay, down here, they have weak muscle in front of the leg. Okay, foot drop and tiptoe contracture. Okay, you can see that. Okay, let's start with the muscle at the front and of the lower leg. I don't have my pencil here. Maybe I can show you later. 1 minute, 1 minute. Looking for my pen. Okay, no battery. Okay, so this muscle, the main muscle here, if you see from the picture, the next picture, the muscle is related to tibialis anterior, and together with the extensor hallucis longus and also extensor digitorum longus. So this muscle, they are responsible for lifting the foot upward. All right. So tibialis anterior together with extensor hallucis longus, extensor digitorum longus. So remember the word, the muscle, and this muscle, they are responsible to lift the foot up, okay, or the movement called dorsiflexion. So in DMD, these muscles, they are gradually become weaker because they cannot lift the foot properly during swing phase of walking. Imagine they are walking, during the swing phase, they cannot clear the ground properly, and the toes begin to drag on the ground, and this is what we call as foot drop. And now imagine this happened every day for several years, and the muscle at the back here, the muscle at the back here, okay, they will gradually the gastrocnemius, the gastrocnemius and soleus, okay, they remain in the shortened position. Why? Because they are constantly pulling the ankles downward. Okay, the thick lower leg muscle. Okay, they become shortened because they are constantly pulling the ankle downward, and over time these muscles, they become tight, and eventually they develop a plantar flexion contracture, also known as this muscle. In order for them to adapt dorsiflexion, these muscles, they are constantly contract in order for them to maintain the ankle, and then at the end they develop contracture on the calf muscle. And over time, this muscle become tight. It develops plantar flexion contracture, or also known as tiptoe contracture. So the sequence is very simple. They have a weak dorsiflexor, the foot cannot lift, the foot drop, and then long-term shortening, and then they will have tiptoe contracture. So how can we provide an orthosis to help in this type of problem? So an AFO, ankle porotosis, they can hold the ankle close to neutral position. So when this type of patient wear ankle porotosis, the ankle will be 90-degree or neutral position, and this will prevent the toes. The toes is the front part of your foot. It will reduce the risk of falling and also help to stretch the calf muscle. So the calf muscle will not be in contraction position, and it will slow down the development of the contraction. All right. Then you see the second one. They have a tight heel cord. Tight heel cord. All right. Where which cause the children to walk on toes. So this heel cord is actually the Achilles tendon which connect the gastrocnemius and soleus muscle. The gastrocnemius and soleus muscle to the heel bone. So when the calf muscle become tight, they will continuously pull the ankle downward into plantar flexion. So because the ankle, they cannot bend upward anymore, the heel cannot touch the ground properly, and this child is therefore forced to walk on the forefoot or their toes. So this type of patient you would normally see in the MD patient, in some of the uh, autism kids with cerebral palsy, and then think of it like they are trying to walk while wearing high heel. So your heel will naturally lift off the ground because your ankle is fixed in a downward position. Imagine you wear high heel, so your ankle is fixed in downward position and difficult for you, and then you will lose your stability. And again, orthosis can help by maintaining the ankle in neutral position by providing prolonged stretch to the calf muscle, helping delay in further tightening. So this is how your answer should be like. Okay, and then you have a poor balance. For example, in the question, they say that this type of patient they have poor balance and they have problem. They often fall. So you need to look at why these children often lose their balance. So balance they depend on several things. First, we need a strong muscle around the hip, for example, like around the all the joint, hip, knee, ankle, in order to keep us upright. So in DMD, Duchenne muscular dystrophy, many of these muscles they become weak gradually, especially the hip muscle, the hip abductor, hip extensor, the quadricep, and the ankle muscle. So because of this weakness, some child they cannot react quickly. Okay, when the body starts to sway left and right, front and back. So small disturbances that most people can easily correct, like us, we can just easily correct the balance, may cause them to lose balance. So on top of that, foot drop means that the toe may catch the ground during walking, so making tripping much more often. So poor balance is not caused by one muscle alone, it is the result of the weaknesses throughout the lower limb combined with the abnormal walking pattern. So and orthosis improved balance by stabilizing the joint. Okay, because you see, we have ankle foot orthosis. It stabilizes the ankle. Knee ankle foot orthosis. It stabilizes your knee, your ankle. Okay, and then and orthosis improve balance by stabilizing the joint, improve foot clearance during swing phase, and provide more stable base of support during walking. And then we have another one, the patient of DMD, they usually have thick lower leg muscle. The muscle is mostly fat and not strong. So think, why is this happening? All right. So if the calf muscle look big, why they are weak? Usually if you see bodybuilder, they have a big muscle and they are strong. So this is called pseudo pseudo hypertrophy. Okay, so this is like one of the answer that you can use to justify your answer. Okay, something related to the muscle. So normally when muscle become bigger, we expect them to be strong, like I said just now. But in DMD, okay, you should know what is the cause of DMD, and the muscle fiber are not gradually destroyed because the body cannot produce enough dystrophin, for example, which normally protects the muscle cell. So as the muscle fiber die, they will die gradually, and then they are replaced by fat and connective tissue. So although the calf look big, most of the size is actually fat and scar tissue rather than heavy, healthy muscle. That's why these children with DMD, they have large calf, but they have very little muscle strength. Okay, so and orthosis cannot make the muscle stronger. So it can compensate for the weaknesses, okay, by the weakness by providing the external support, reducing amount of effort needed during walking, and help the child remain mobile for longer period. So remember this sequence because it applies to many neuromuscular disease. For example, muscle weakness will usually leads to abnormal joint movement, and then it will change the way the patient walk. Okay, and over time this abnormal movement will cause contracture, will cause deformities, will cause a balance problem. And the role of orthosis is not to cure the disease, will not help to strengthen the muscle. So instead, it our orthosis that we prescribe should support the weak muscle, improve the alignment, prevent deformity, increase safety. What else? And also help mainly help to help the patient to walk more efficiently. So whenever you see a patient, always think of this order first. Which muscle is weak? And then if muscle A is weak, what movement is affected? And then as movement is affected, how does it change the patient gait? And then which orthosis can be best to compensate this problem? So if you can answer those four questions, you will be able to justify almost any orthotic prescription. All right. So like I mentioned just now, one of the question in exam, in final exam, you have something related to evidence-based design. All right. This is one of the question where many students lose mark because they misunderstand what evidence-based practice actually means. So some students they think that as long as they mention one journal, one article, they have already answered the question. But actually, that's not part of the answer. So first, evidence-based practice is about combining three important elements. Okay. We have here. Okay, we have here. 1 minute. Three important elements, which is one, best available research evidence, and then second one, the clinical reasoning and biomechanical knowledge, and the third one, patient individual needs and goal. So only when these three best research evidence, clinical reasoning, or your knowledge, especially your knowledge, and also patient needs. So if the question asks you to design an orthosis, don't immediately jump into the design. Start by understanding the patient. So ask yourself, what patient diagnosis, what functional problem, what activities does this patient want to perform? Okay, if the patient is small, he or she wants to join sport. So you need to think of all of that. Okay, once you answered those questions, then you think about the orthosis. Don't just write, I recommend an ankle foot orthosis, but instead explain which type of AFO, why you select that design, what material you will use, whether solid ankle, articulated ankle, what trimline, all right, and how that this design features address your patient specific problem. Then come the evidence. All right, support your design with a research or clinical guideline. For example, you might write previous studies have shown that solid ankle prosthesis improve ankle stability and reduce foot drop during swing phase in children or neuromuscular disorder. Or according to the current clinical guideline, or you can cite the article also. An articulated AFO may be beneficial when ankle dorsiflexion is preserved and controlled motion is desired. Notice that when you just quoting your research, you are explaining how the evidence support the decision. And another important point is not every research paper applies to every patient. For example, if a study was conducted on an adult, okay, adult after stroke, can you directly apply those findings to 7-year-old child with other disease, for example, ITW, idiopathic toe walking? Probably not, right? So one of the things that examiner look for is when you can recognize the limitation or the available evidence and explain how the patient specific factor influence the final decision. Okay, you can think about things like patient age, activity level. Usually in exam question, they will provide you with all this information. You can use all of this information to justify your selection of the orthotic selection. Okay. Evidence-based practice. Okay. So when I ask you to support your orthotic design with evidence, I'm not asking you to simply find the journal like I mentioned just now, and copy some of the sentence from the journal. Okay, evidence-based practice is actually a combination of three things. You can see here. You the first component is the best research evidence. This includes systematic review, randomized control trial, clinical practice guideline, or any research or published research. So these studies tell us what has been shown to work in similar patients, sorry. So second component is your clinical expertise. So this is where your understanding of anatomy, biomechanics, gait analysis, and orthotic design become important, because research may tell you that an AFO improved gait, but your clinical knowledge help you to decide which type of AFO is most appropriate for the patient and how it should be designed. And the third component, if you see there, the patient's values and needs. So remember, we don't design orthoses for textbook, we design them for the people. So every meaning that every patient is different. We need to consider factor like age, activity level, lifestyle, compliance, comfort, cosmetic, what else? Personal goal, and for example, a child who wants to participate in sport, okay, they may need different design compared to an elderly whose main goal is simply to walk safely at home. So when these three components come together, we make the best clinician decision. And now let's look at the hierarchy of evidence in the middle of the slide. Okay, see, not all evidence has the same strength. Okay, at the top are systematic review and meta-analysis, because they combine results from many high quality studies. Okay, they combine few studies and they come up with the conclusion. And then below that is the randomized control trial, followed by clinical practice, guideline, cohort study, and case report. But don't worry, I don't expect you to memorize the entire hierarchy. Okay, this will not come out in your exam. The important point is to understand stronger evidence generally provide greater confidence in your clinical decision. And then also US and orthotis, for example, in the rehab clinic, for example, in year 4, you will visit rehab clinic. Okay, you may use this is the result from any published article to tell the doctor what is actually happening, okay, to strengthen your justification. And and now in evidence, in using evidence in your exam answer, always start with the patient before you even think about the autosis. All right, maybe I can give you one example. 1 minute. Okay, for example, you can say something like clinical studies have shown that hinge AFO, they improve ankle dorsiflexion during swing while allowing controlled tibial progression during stance. So therefore, this design is suitable for patients with mild dorsiflexor weakness who is still require ankle mobility. Okay, if you see bad answer, for example, research show that AFO are effective. That is very short, and uh, it's not explaining, it do not connect the evidence directly to the patient problem and explain why the design is appropriate. So instead of saying, answering, research A show that AFO are effective, you should explain the evidence of it. Clinical study have shown that this type of AFO improve ankle dorsiflexion. When? During swing phase. How? While allowing controlled tibial progression during stance. And what will happen? Therefore, the design is suitable for a patient with mild dorsiflexor weakness who still require ankle mobility. What's the patient needs? All right. And then we have uh, professional practice. Okay, this time in year 4, you will have some question related to professional practice. Okay, so many students think that this is the easiest question because there are no calculation or no biomechanics involved. However, like for example, they say US and orthotis. Okay, your patient say that I don't want to wear this because this doesn't give me comfort. And then can you reduce the pressure at this part and that part? All right. So you as a professional, what is the best way to answer? Like I said just now, maybe you'll think that this is a easy question because you don't need to mention about the biomechanics and all, but this is one of the things that you will face um, in your working phase later. All right. So here, okay, I want you to remember the question is not asking what would you do. It actually asking you what should a prosthetist or orthotist do as a healthcare professional? So your answer should always be based on the professional ethics, the code of conduct. We share also with you, or you can Google code of conduct, or code of practice for the prosthetist and orthotist. Okay, you need to your answer should be based on the professional ethics, code of conduct, patient safety, accepted standard of practice, and not your own personal feeling or preferences lah. So, for example, imagine the patient refuses. Okay, patient A come to the clinic, and then you make an ankle foot orthosis, and the patient refuses to wear the orthosis. So, some student may answer, "I will respect the patient decision and let them go." Okay, that is incomplete. As a professional, you should first understand why the patient is refusing the device. Is it because the orthosis is not comfortable? Does it cause pain anywhere? Is it because the material is making them uncomfortable? Is it too heavy? Does the patient do not understand the purpose of the device? And here, good communication, which is one thing in the code of conduct, in, like, for example, in ISPO, like, code of conduct. Okay, good communication is a part of professional practice, and you should educate the patient first. Okay, good communication is good, and then educate the patient is second one. So discuss the benefit and also risks, explore the possible solution, and also document the discussion. This is also a part of the professional practice. So at the end of the day, you respect the patient decision, but you have done your job. You have professional responsibility. You need to ensure that the patient has enough information to make a call, to make an informed choice. So now let's look at the key area that you should address first is the professional code of conduct. I have it here or no? Okay. So this should always guide your decision making. If you have a copy of a code of relevant professional guideline, you will need this next year. Okay, bring them to the exam because they can strengthen your answer. Second, the ethical principle. Right, you don't have to memorize difficult terminology, but you should understand ideas such as doing what is best for the patient, avoiding harm to the patient, respecting their patient autonomy. This is also similar to the one that used by the doctor. Okay, treating the patient fairly and maintain the honesty and also the integrity. And another important area is the patient safety. In every clinical decision, ask yourself, is this the safest option for my patient? Okay, and because safety should always come before the convenience, and documentation is also one of the important thing. Like, for example, if anything happened, you have a proof. So as a healthcare professional, if something is not documented properly legally, it may be considered as if it never happened. So always record the assessment. So now you are doing logbook, right? It's actually important. So treatment decision, patient education, and also follow up accurately. So, and also the other thing, the most difficult thing for us, I don't know why, we have difficulty in communicating with the patient. Okay, communication is one of the important thing. Okay, we work with the patient, with the caregiver, not only the patient, the caregiver, and then also the multidisciplinary thing, the doctor, physiotherapists, occupational therapists, and many other healthcare professionals. So this thing also you need to you this topic is covered in KIB 4031 next year. Next, yeah, year 4. And good communication, it reduces the misunderstanding and improve patient care. Professional boundaries are also uh, important. Okay, you need to maintain a respectful and professional relationship with every patient, and then do not let personal opinion or emotion influence your clinical judgment. For example, you don't like this patient, a lot of complaint, so you just prescribe uh, an ugly orthosis for the patient. So this is also one of the things. Say on the right side of the slide, you will see example of the issue that may appear in exam. Okay, and not this, not your class. Okay, so this include confidentiality. Okay, informed consent, conflict of interest. Okay, continuing professional development, reporting error, patient non-compliance, teamwork, ensuring fair access to care. Okay, you do not need to memorize every possible scenario. Instead, you should understand the principle behind them. So whenever you answer an ethics question, I recommend following the simple approach. This simple approach: first, identify the issue. Second, analyze the situation by considering the patient first, the healthcare team, the possible consequences. And third, apply professional principle or code of conduct. And then after that, you can decide what the professional should do. And finally, justify your decision by explaining how it can protect the patient and meets the professional standard. And the structure will make your answer logical and easy to follow lah. Okay. So throughout this course, we have discussed anatomy, biomechanics, orthotic design, research evidence, but none of this matter if we forget about our professional responsibility. So you will use this in the real life and also in your exam. And then comparing, how to compare two orthoses for one patient. Okay, this is most probably the most challenging question in your paper, because in exam they will give you a confusing question and then ask you to choose A or B. All right, and then after you come out from exam hall, you ask your friend, Nada ask Amrin, which orthosis you choose. Nada choose A, Amrin choose B. So this may be tricky, okay, because it requires you to think like a clinician and also a researcher at the same time. Okay, imagine you have two orthoses in front of you. The question is not asking which one is better. Instead, it's actually we, as an examiner, we are actually asking which one is better for this specific patient and how you can prove it. Okay. So the first thing you should always do is to understand the patient. Like I said, I mentioned like few times already. First thing is the patient. Before looking at orthosis, ask yourself what is the patient diagnosis? What are their gait problem? What are their goal in life? And then, for example, if the patient is are more concerned about their stability, their walking speed, they worry if they fall, how to reduce their how to reduce fatigue. So different patient, they have different priority. So there is no single best orthosis for everyone. So once you understand the patient, so the next step is to compare the two orthoses. Okay, and don't simply describe them, think about their biomechanical characteristic. So one design, for example, if we see here, and solid AFO and hinge AFO. Okay, so one design may provide greater stability, but it restricts the ankle motion, which is the solid AFO, while another, the hinge AFO, they may allow more natural gait. Okay, you can have a little of dorsiflexion and plantar flexion, but it will provide less support for you. So your job is to explain differences using, siapa baru join tu? Okay, your job is to explain these differences using biomechanics. And then the next part is designing an experiment. Okay, may also come out in your exam. You need to design an experiment. So think like a researcher if you want to compare these two orthoses fairly, for example. So both orthosis A and B, they should be tested under the same condition. Okay, because you want to compare, right? So the same patient should wear both the same type, both orthoses. They need to use the same footwear. Okay, they wear ankle for orthosis, but their shoes should be the same. they should walk on the same surface, and then they should perform the same walking tasks. And the only things that should change is the the orthosis itself lah. So this ensure that any differences in the result are caused by the orthosis, not by the other factor. Then you need to decide what you want to measure, what parameter. This one also you will use in your final year project. Okay. So in IDP, you only come up with the prototype. But in your final year project, you need to come with like experiment, analysis, and so on. So ask yourself what biomechanical parameter will tell me which orthosis perform better. Okay, what biomechanical parameter? You might measure their walking speed. Okay, patient A use AFOA, and then they walk faster than when they wear AFOB. Okay, you need to check their step length, their ankle range of motion, their plantar pressure, for example, their ground reaction force, um, or even their energy expenditure. Like for example, a patient A where this type of AFO, the energy expenditure is higher than when they use AFOB. So you can use all of these parameter. So don't choose parameter unless you can explain why it is important. Okay. So after collecting the data, so this is related to the experiment. Yeah. So after you collect the data, okay, you don't stop there. The most important part is interpreting the result that you get lah. So suppose one orthosis improve the stability but reduce ankle mobility. Okay, improve stability is improved, but the ankle mobility is reduced. So does that automatically make it a better design? All right, not necessarily. For this type of patient, it depends on the patient needs. A patient with poor balance, for example, they may benefit more from extra stability, while more active patient they may prefer greater mobility even if there is slightly less support. And finally, think about the trade-off. This is also one of the important thing, the trade-off. In orthotic design, every decision has advantage and also disadvantage. So you increase the stiffness. Usually we increase stiffness when we want to improve the stability, like for example, solid ankle orthosis. But it may reduce the comfort and also the natural movement. So allowing more mobility may improve the walking efficiency, but it can also reduce the support. So this is a rarely a perfect. There is rarely perfect orthosis. So when answering the question, do not simply choose the design A or B. Show the examiner that you understand the patient. Compare the biomechanical effect. Design a fair experiment, interpret the result, and then make a clinical decision. So this is exactly how a prosthetist or sorry, how orthotist thinks in the real clinical practice. I think the last slide, I think we have two more. Okay, before we continue, I like to give you one tip that you will find a lot of biomechanics term in your exam. Biomechanics term. So you need to understand uh, what is this term is actually mean. So sometimes the question will ask you explain this condition by using biomechanics. Explain biomechanically. Justify your answer biomechanically. So when you see those words, do not panic. There's actually a very simple way to approach the answer. So many students they make mistake of describing the orthosis. For example, they might write the AFO support the ankle and prevent foot drop. So this is wrong. Not really, but it is not a biomechanical explanation. So you will not get full mark lah here. So instead, I want you to think through a sequence of questions. First, the first question, for example, what is the biomechanical problem? Meaning that what is actually happened to the patient mechanically. So is it foot drop? Is it hyperextension, knee hyperextension? Is it excessive pronation? Is it the patient is having unstable ankle. Okay, you identify the problem first, and then this is actually repeating the second slide just now. So which muscle is affected? Ask yourself which muscle is weak, which muscle is tight, which muscle is paralyzed, which muscle is not functioning properly. Okay, for example, in foot drop, the main muscle affected is tibialis anterior. Okay, this tibialis anterior responsible for dorsiflexing the ankle. All right, then after that, ask yourself what happened to the joint if this tibialis anterior is not responsive. Okay, because tibialis anterior is weak, for example, the ankle cannot dorsiflex properly during swing phase, and instead the foot remain in plantar flexion. Okay, now after that, think about the consequences. What biomechanical effect? Okay, what biomechanical effect? If the foot stay in plantar flexion, the toes do not clear the ground. The patient may trip, so they start compensate. How? By lifting the hip higher. Okay, swing the leg outward, circumduction, hip hiking. Right. Now, so this compensation increase the energy expenditure, and then it will make the walking less efficient. So only after you understood the problem, then you should introduce the orthosis. So ask yourself, how does this orthosis change the biomechanics? All right. So then don't just say the AFO support the ankle. Instead, explain what it actually does. For example, the AFO, where is it? Okay, okay. The AFO resists plantar flexion. Okay, this is also biomechanics. You explain use biomechanically. The AFO resists plantar flexion and maintain the ankle close to neutral position. Okay, and these improve the toe clearance during swing phase, and then it promotes heel strike during the initial contact, reduce foot slap, and provides greater stability during stance phase. So notice that every sentence explain how the mechanics change. Plantar flexion, resist plantar flexion, neutral position, improve toe clearance, promotes a high heel strike, um, reduce foot slap, and then it will leads to greater stability. And finally, you can finish with the final outcome. What does all of this achieve for the patient? Okay, the desired outcome number 5. Usually the answer is something like improve walking efficiency, better stability, reduce risk fall, reduce energy expenditure, or improve independence. So the structure is actually very simple. Problem, muscle involved, the joint movement that become abnormal, the biomechanical consequences, and then how the orthosis change the biomechanics, and then finally describe the functional outcome. So if you follow this sequence, your answer will sound like you are thinking as a orthotist rather than simply memorizing the facts. So remember, biomechanics is not about naming orthosis. It's about how orthosis changes the forces movement of the body to improve the function. Okay, remember problem, muscle, joint, biomechanical effect, orthosis action, functional outcome. Five. 1, 2, 3, 4, 5, 5, 6. Okay. All right. Another example of the other disease. No. Okay. Okay. This is example of the other disease. We can see we have example 1, weak quadricep. Example 2, posterior tibial tendon dysfunction. Example 3, cerebral palsy. Right. Now let's apply biomechanical reasoning. Maybe one of these will come out in your exam lah. Okay. So one has weak quadricep. Okay. So the picture here, quadricep is not there. Quadricep is not that. Yeah, you can Google where is quadricep. Okay. Um so another has posterior tibial tendon dysfunction, and the third one has cerebral palsy. Different diagnosis, different ages, for example, different orthosis. However, if you look carefully, the thinking process is exactly the same. Okay. Whenever you are presented with clinical case, do not immediately think orthosis you are prescribed. First, what is impaired? Second, biomechanical problem. That does the impairment create? How does it affect the patient gait? How can orthosis modify? And lastly, what do I expect to see? So example number one, the weak quadricep in this patient, the impairment is weak quadricep. What happened when the quadricep is weak? They cannot control the knee during the loading response and it will prevent it from collapsing. So when this muscle is weak, the knee become not stable. Okay, the patient may walk and buckle during the stun phase. So as a result, the patient has difficulty accepting the body weight and has higher risk of falling. So some patient will compensate by leaning their trunk. Okay, they bringing the force forward or pushing their thigh with their hand to keep the knee straight. So what is our orthotic goal? So it's not the strengthen the quadricep, of course. Okay, if they want to strengthen the quadricep, they go to physiotherapist. So us as orthotists, we should provide mechanical stability. So for this type of patient, we can provide a knee ankle foot orthosis. Okay, because we can control the knee with a drop lock. So careful with drop lock, it can help the knee extend during stun phase, allowing the patient to bear their weight safely. So notice that an orthosis change the mechanic, it will not change the muscle. Okay, now we look at example number two, posterior tibial tendon dysfunction. The patient doesn't have weak quadricep now. Instead, the posterior tibial tendon is no longer able to support the medial longitudinal arch. So as the tendon become weak, okay, the arch begin to collapse. The arch here begin to collapse. Okay, and this will lead to excessive pronation of the foot lah. So once the foot pronates excessively, the alignment of the entire lower limb will change. So the patient often complain about the pain around the, usually for this type of patient, they will have pain in the medial ankle lah. Medial ankle, their arch, okay, their knee sometimes, their hip, because all the forces they are no longer distributed normally. So what can we do? Again, we don't repair the tendon using our orthosis. Instead, instead of functional foot orthosis, okay, support the medial arch. We can give foot orthosis. We can give an insole to support the medial arch and can reduce the excessive pronation. So these improve the alignment. It will redistribute the pressure and then decrease the workload on the tendon itself. Okay. And then we have example, the last example, cerebral palsy. Now look at our third patient. Okay. It the problem is not weakness, it's spasticity. Spasticity, yeah. So the gastrocnemius and soleus muscle, they are overactive. Okay? When they are overactive, they keep the ankle in plantar flexion, ankle in plantar flexion. And biomechanically, this will produce an equinus position. Okay? Equinus position, like uh, like toe walking. So the child, they walk on the toes, they loses heel strike, okay, they have reduced stability because of that, and eventually they may have developed contracture lah. So our orthotic goal is to control excessive plantar flexion. We can prescribe an ankle, a solid AFO to hold the ankle closer to neutral position, neutral range of motion, and allow a more stable heel strike and improving their walking pattern. So again, notice the principle, the AFO doesn't remove the spasticity, it changed the mechanical position of the ankle to improve the function. So what do all of these three examples show us? So although the diagnoses are completely different, the clinical reasoning process is the same. So every patient follow the same sequence. First, identify the impairment, then determine the biomechanical deficit. Next, understand how the deficit will affect the function. And after that, select an orthosis that can change the forces acting on the body. And finally, think about the outcome that you want, the outcome that you expect to achieve. And this is exactly the thought process of that I want you to have in your answer. Okay, again, don't simply write this patient has cerebral palsy, so I give AFO. Instead, you can explain something like this. The patient has excessive plantar flexion caused by spastic calf muscle, which result in toe walking and reduced stability. So I prescribe ankle foot orthosis, solid ankle foot orthosis, in order to resist the plantar flexion, in order to restore the heel contact, in order to improve the ankle alignment and produce a safer and more efficient gait. Okay, so that is biomechanical reasoning. And then, so whenever you answer your orthotic question, remember impairment, biomechanical deficit, functional problem, orthotic intervention, expected outcome. All right. So before we end our class today, right, I like to remember one final message throughout this course. We have learned about anatomy, physiology. If you see the course outcome, the biomechanics, we are actually in this class, we mostly focus on the patient problem. Okay, like I mentioned before, this part usually uh, come from a doctor, but we have some problem now, so I'll try my best to share with you what we as an orthotist should know. Okay, we learned about anatomy, physiology, biomechanics, gait analysis, orthotic design, fabrication, evidence-based practice, professional ethics, and before we may see that this all is like a separate topics, but in clinical practice they are actually connected. Okay, and I want you to connect all of this dot in your final exam. Okay, I think I don't have any more tips for your final exam. I wish all the best. Thank you for your attention and for your AFO project. Later, if you have exam and you don't go home, you can just continue to modify. If not, we will continue in next semester. All right. Do you have any question? I will also share the recording in the spectrum later lah. Okay, if no more question, we end the class for today. See you in exam hall. All the best.
Thank you, doctor.
Thank you, doctor.
Thank you,
Okay, bye
doctor.
bye.
Doctor.
Thank you, doctor.